So usually there is some sort of contact it's a contact injury. The patient will come with a typical story of either they're playing a certain game or they were doing something and accidentally hit up against a wall or something like that. And then the biggest complaint is generally a headache that either will or won't go away. And then along with that are just a variety of symptoms. It can range from confusion to dizziness, pain with bright lights or with loud noises that don't seem to go away or get worse if that stimulus is still there. So for example, if there was a student that was playing soccer, they collided with another player, they have a few of those symptoms, but not all of them. I'll generally do my assessment, check things like their eye movement and their balance, check their memory, and then sit them out for a little bit. I'll have them sit in the stands. I'll come and check in on them every few minutes and ask them how they're doing. If just being in the environment that we're in is triggering those symptoms to get worse, like the noise of either the players that are cheering or the audience that might be cheering, or even the music that they play whenever there's a timeout, if that starts to irritate them, that makes my suspicions a little bit higher for a concussion. But a concussion is, like I mentioned, usually contact injury. There's still not a lot of kind of research to show or prove what happens in the brain when a concussion occurs, but we believe that there's probably some irritation or some inflammation somewhere around the brain that causes these symptoms to occur. And we know for sure that rest, especially rest from activity immediately after the injury, can help with the recovery process.